Hello everyone, and welcome to our MPTA poster presentation. Today I will be talking about the effects of isometric training on the Nustep in patients with chronic stroke. My name is Melissa Rudo, and I worked alongside Alyssa Redoute and Chelsea Shellman with Vicky Pardo as our faculty mentor. The Nustep is a recumbent stepper that focuses on rhythmical, repetitive movements to improve strength and motor function of the extremities. Research has shown that task-specific training greatly increases leg movement in individuals post-stroke. In addition, Nustep training has also been shown to increase isolated leg movement, balance, and gait velocity in individuals post-stroke. The Transit is an updated version that provides a visual feedback gaming aspect, leading to the purpose of our research. To determine the effect of isometric lower extremity training with visual feedback game on balance, gait, endurance, and force production in chronic stroke. The photo to the right is the Nustep Transit. There is a tablet display with real-time feedback of performance during interactive games and training. The photo to the left is the screen that is seen during the participants' warm-up and cool-down, which allowed participants to alternatively step for 5 minutes. The green dot is the participant's real-time pace, and the white circle is the preset pace. The center photo is the paddleball game, which we use during our interventions. With the pedals in a locked position, the paddles were manipulated up and down through isometric contractions of the lower extremities. The paddles moved up and down based on the amount of pressure that the participants put through their lower extremities. The green ball bounced back and forth in a similar fashion to ping pong. 20 participants with chronic stroke were recruited. Participants completed 10 visits. During sessions 1 and 10, the following outcome measures were used. Analysis of gait parameters using the gait right for normal and fast gait. The 5-time sit to stand, a measure of strength, balance, and endurance. The 4-square step test, a measure of balance and lower extremity coordination. Maximum voluntary contractions of knee extensors, knee flexors, plantar flexors, and dorsiflexors. Average peak force and peak time were recorded for 3 trials. The lower extremity Fugl-Meyer assessment of motor recovery and sensation. The lower extremity functional scale, which is a subjective assessment of lower extremity function. And the 6-minute walk test, an endurance measure. Visits 2 through 9 consisted of the intervention sessions. Vitals were taken prior to exercise. Each visit consisted of a 5-minute warm-up and cool-down, with 35 minutes of visual feedback isometric paddleball game, with the participants in a locked position with feet strapped in place. Participants would alternate between the left versus right push and left versus right pull for the 35 minutes, with 5-minute intervals at a time. The push was accomplished by the lower extremities pushing onto the Nustep pedals, activating hip extensors, knee extensors, and plantar flexors, while the pull was accomplished by the lower extremities pulling on the straps, activating the hip flexors, knee flexors, and ankle dorsiflexors. Participants were allowed seated rest breaks as needed throughout the session. The results of our study demonstrated many significant findings. Each of these findings are denoted by the red asterisk on the next 3 slides. For the 5-time sit to stand, participants improved their average time from 15.75 seconds to 11.97 seconds. The mean for 4-square step test scores also improved significantly from 17.69 seconds to 11.63 seconds. Here are the results from the assessment of gait on the gait right walkway. For the fast gait speed, there were significant changes in step and stride length on both the hemi and non-hemi lower extremities, as well as overall gait speed. For the normal gait speed, there were significant changes in step and stride length of the non-hemi leg, stride length of the hemi leg, and overall gait speed. And finally, the Fugl-Meyer lower extremity motor, but not sensory, improved significantly. The lower extremity functional scale increased significantly. The 6-minute walk test significantly improved from 948 feet to 1,090 feet. and the maximum voluntary contraction for knee extension of the hemi-lower extremity improved significantly from 56 to 58.4 pounds of force. All other MVCs did not show significant changes. Overall, we found that the Nustep Transit provided participants with a challenging and engaging gaming experience with visual feedback, causing subjects to activate their hemiparetic leg. This resulted in significant improvements of leg function, including strength and coordination, as well as overall functional mobility and endurance. The significant changes in 5x sit to stand, 4 square step test, 6-minute walk test, and gait parameters may translate to safer transfers, a decrease in fall risk, and improved functional mobility in the chronic stroke population. These are the references that we utilize to help develop and guide our research. Finally, we would like to acknowledge all of the study participants, as well as the funding received from the Nustep LLC and the Small Companies Innovation Program grant.